Approaches to prevention and treatment. Diseases were treated in many different ways during this period. For example, leeches and purging were used to try and balance the four humours, and herbal remedies were used, such as using mint for stomach aches or garlic for wounds. Herbal remedies were usually administered by the women in the family. Remedies were written down in books known as herbals and passed down through generations. Apothecaries were people who sold herbal remedies to both patients and physicians, and were much cheaper than seeing a doctor. Those that could afford it could go to see a physician or doctor if they were ill. Doctors were usually trained in the works of Hippocrates or Galen and used herbs and charms. Barber surgeons were not trained and carried out medical procedures such as amputations and bloodletting, but they also cut hair. You could visit a hospital if you were ill. Hospitals were run by monasteries and offered a place where patients could rest and recover, and they were kept clean by nuns and monks. However, treatments were not very effective, so people often focused more on not getting ill in the first place. Most preventative methods were either religious or air purifying. Religious preventions included living a life free of sin, flagellation, which was whipping or harming yourself as punishment for your sins, attending church, and praying. And air purifying preventions including lighting fires to drive away bad air, building public toilets in towns, carrying posies of herbs or flowers, punishing people for throwing waste on the streets, and ringing bells in the house to keep the air moving. Islamic medicine and surgery were advanced for the time and played a significant role in shaping medical knowledge in Europe. Islamic scholars preserved and built upon the work of Hippocrates and Galen, translating them into Arabic and adding their own discoveries. Physicians, such as Ibn Sina, also known as Avicenna, wrote important texts like the Canon of Medicine, which became a key medical textbook for centuries. Islamic medicine emphasized careful observation, diagnosis, and treatment using herbal remedies, surgeries, and techniques like cauterization. Hospitals, known as Bimaristans, were established in Islamic cities and provided medical care for all, regardless of wealth or religion. These advancements were crucial in spreading medical knowledge to medieval Europe, as many texts were later translated into Latin and studied by European physicians.